Okay, welcome everybody. Today we're going to talk all about health and health needs and how we assess them. So first of all, this concept of what actually does it mean to be healthy. And one of the things that people have come through with in the past is this recognition that actually to be healthy is more than just the absence of disease, but you can be healthy even when you have a chronic illness. It's quite subjective. So for example, the person in the picture may well not be able to use their legs, but that doesn't mean that they wouldn't see themselves as healthy. So our concept of whether somebody is healthy or not really comes down to what's their potential and whether they can reach their potential with what they've currently got. The World Health Organization has come up with a very complex definition of health, saying that basically health is a state of complete physical, mental and social well-being, and not merely the absence of disease or infirmity. And that leads us to a rather tricky question of what's a health need? What do we need to be healthy? A lot of this relates back to what we've discussed in previous sessions, talking about the wider determinants of health. So we need shelter, we need food, we need clean water. It's very handy to have a job. It's good to have social supports. We need money to get the things we need. We need access to care and treatment when we're sick. These are potentially all health needs. Now, before we can start measuring health needs, we have to have a reality check here. There is no way we're going to have an answer for every problem. We don't have, at the moment, an effective treatment for every condition that we can get sick with. And there are many problems that we mitigate but can't eliminate. And by this I mean there are a lot of chronic diseases, for example arthritis, where we can't stop the process, we can't reverse the process, but we can certainly help people deal with the pain that comes from it. And finally, at the end of the day, we're all going to have to die of something. So we have to accept that people will die, and that there is a point where we will have to distribute our resources to the point where they're helping people as much as possible within the resources we've got. So, what should we be providing as a health service? Should we be paying for treatments if we're not sure if they work or not? This is true for a lot of things that we currently offer. We aren't really 100% certain that everything we do in healthcare works. There are a lot of things we do that make people feel better, but that don't cure them. Should these be valued in the same way? Where do we draw the line? An example might be when we look at drugs for cancer. Certain medications that we give people for cancer have no chance of curing them. However, they could make them live a bit longer. The question is that worth the same as another drug for somebody else who might actually cure them? And this comes to a question of what do we need versus what we want versus what is actually supplied. The reality is that in society, what we want is going to be potentially infinite. We all want a longer life. We all want to be happy. We may want to be more attractive. What we can actually supply is restricted because our resources are not infinite. We don't have infinite money. We don't have infinite time. And people have other things that they have to do with their lives beyond work on keeping themselves healthy. That leads us to a difficult question: is what we supply really what is needed? How would we ever define a health need? One definition that has been used and that is quite helpful is this concept that a need is something where a person who has a need has the ability to benefit from an intervention. So there must be something we can actually do to meet their need or to make them healthier. If you want, you can try this game, which we may end up using in the classes. Draw 3 circles and think about things that may be needed, things that are demanded by society, and things that are actually supplied. What you'll find is that you can put things in different places within these circles, and that if you do it and a friend does it, you may often choose different places to put things. For example, let's think of vaccinations. Depending on where you are in the world, vaccinations may be needed, but neither demanded nor supplied. They may be needed and demanded, but not supplied. And in other places, they may be needed, demanded, and supplied. And in many countries, where they're needed and supplied, but people don't want them. This leads us to a difficult question. How can we really decide what a health need is? What this game shows is that context is important. Where you are in the world, what country you're in, what conditions are common, and what resources are available to you will all make a difference to this definition of what's a need, and even more so to the process of prioritizing those needs. Our definition of need is always going to be subjective, and this is where politics comes into things. Politicians will have to make difficult decisions in order to prioritize what we do. And this brings us to a very simple definition of politics, which I've heard from one of the professors of politics at Sheffield. Politics equals who gets what. Now, when we're looking at health needs, one of the problems is that numbers don't always tell a whole story. We can be very reliant on the numbers that we measure, but we may be fooling ourselves if we think that those numbers can tell us what we need to offer a population. Why is this so? Well, one of the most common things is that we're not measuring the right things. When we look at how people are doing, we often just measure how long they live. We find it much harder to measure how happy they are with the life they're living. Another common problem is that we might be measuring badly, so while we've got a good measure, we're not doing it in the right way or in the right place, so what the data we get doesn't mean anything useful to us. An equally common problem is that people might not want to tell us exactly what their problems are. For example, when we ask people if they smoke or not, they often say they don't when they do. When we ask people how much they drink, they often underestimate their overall alcohol consumption. And when we ask people how much healthy food they eat, they often say they eat more than they actually do. So, what does all this mean? The fact that we can't use numbers for everything? Well, really we need to start thinking about asking people for their opinion. We need to think about who we ask and also what kind of question we're going to ask them. Which leads us to three basic ways of assessing health needs. The first and simplest is to simply look at the numbers and see whether we think they're high or low. But we can't really come up with a decision about whether a number is high or low unless we compare it to something else. And we can compare it to another country. We could compare it to the rest of our country. We could compare it to average levels in the city. We could compare it to what it was like last month, last year, last decade. All of these questions rely on us comparing to something that's useful to compare against. When we ask these kind of comparative questions, I guess the essential question is, are we doing as well as we were or as well as the place we're comparing ourselves with? And if we're not, do we need to change something? Can we learn from the people who are doing better than us? Another common way of assessing health needs when we accept that the numbers don't always tell us the full story is to simply go out and ask people. This revolutionary concept has changed the way we do health needs assessment quite dramatically. However, it's not always that simple. Who do we ask about health needs is a common question. The basic answer should be we should ask our patients, but it's often difficult to find individual patients who can help you, and so sometimes you'll end up approaching patient groups. Patient groups can be very, very helpful. However, you always have to think about how a patient group is supported and how a patient group is put together. For example, patient groups may often be funded by drug companies trying desperately to promote their products. Another group that we always want to ask about health needs is clinicians. But then there often comes a contrast between whether we look at national and international experts or whether we want a local picture. Realistically, we're probably going to need both. A group who may not be able to tell us that much about health needs, but who are very important, are the politicians. Politicians can be very helpful in giving us some idea of health needs because they are often out talking to people every day. However, they may also have difficulty assessing things because they have to get re-elected. However, it is very important to involve politicians in discussions early because they're going to be vitally important in implementing anything. For the same reason, we need to involve the press and the media when we're looking at health needs. They may be able to find us more information, and they will also be vital in anything that we do at the end of the day. We should also think about really important groups such as charities, thinking about the people who care for patients and other groups as well, because they will probably have a better insight into health needs than we will coming from outside. However, when you ask people about their health needs, there's always a risk. One of the biggest risks is that you get answers you don't like. For example, in the cartoon here, somebody's gone out and asked, "What do we need?" and everybody's come back saying, "We want a new GP surgery." And the poor commissioner is sitting there thinking, there's no way I can get the money for that. This has created an unrealistic expectation in the population. And this is a common problem when we go out and ask people about health needs. We get an answer we don't like because we can't afford to fix it. Another common problem is that what people come back with is at odds with the numerical data that you've got. People can often feel that they need something that actually, when you look at them compared to the rest of the country, they're doing quite well in. Again, this can create an unrealistic expectation in the population. What you have to do is make sure that you're realistic right from the start with the people you're talking to about what you can offer and what is on the table. Another common problem when we ask about health needs is that we ask people who have a vested interest. This may be financial or it may be health related. For example, drug companies are always keen to sell us a new drug, and one of the reasons why they want to sell us a new drug is because their older drugs get cheaper when they come off patent. So they're often very keen to make sure that their new and latest drug is the one that everybody needs. An example of a health-related vested interest is when you ask a patient group, you may get a very focused answer on one condition, when realistically you need to be thinking about a range of things. For example, if you go and ask the British Heart Foundation about what the most important problem facing health in the UK is, the odds are they're probably going to come back and tell you it's something related to the heart. So in summary, health is tricky to measure. A lot of this stuff is subjective and we can't just rely on numbers, and so we have to go ahead and ask people. But when you ask people, you will inevitably get different answers. This means it's always political. There's no way that you can separate assessing health needs from politics.